Hello and Assalamu alaikum. Welcome to Scan Diagnostics. Here, this is the CBCT of the patient which you had requested. The area of interest is the lower anterior region for implant placement. As you can see on the transaxial view, let's start with the lower left lateral incisor region. We've got very thin ridge. Now our doctor will have to slightly do a coronary a slight alveoloplasty, and we'll have to go slightly deeper to get some form of bone width. So if we go slightly deeper, we have approximately 3 millimeters or 4 millimeters of ridge width. And then when we move towards the central incisor region, here also we've got ridge width, but it's also thin at the crest. So we'll have to go approximately 5 millimeters deep, do an alveoloplasty, and then we'll get at least 4 millimeters of ridge width to place an implant which is going to be slightly shorter, 6 to 7 millimeters in height. When we move towards the lower anterior, again very thin ridge. Now this is the lower left lateral region. Again very thin ridge. We have to go approximately 4 millimeters deep to get enough bone, 4 millimeters to place a 7 millimeter implant. And then the lower right canine lateral region. Here we have ridge width, so we can place a 5. We have 5 millimeters of ridge width with approximately 9 millimeters of height. Thank you very much. Now just showing you a quick axial view, so you'll be able to see right here at the bottom, very thin ridge at the crest, and as you move deeper, this is mid crestal level where we have enough bone for placement, but that will be too deep for implant placement. Thank you very much.